Namaste to one and all. We are really fortunate and privileged to have with us none other than pioneer in the field of yoga therapy, Dr. R. Nagarathna. We welcome you, ma'am, for this session today. She is a doctor who blends medicine with love and compassion. Today, ma'am, we have some interesting questions with us. Can we proceed with the questions for today?
Sure.
So, to start with, how did you gain interest in merging yoga therapy, meditation with the conventional medicine, and how did you take up yoga as a career?
Yeah. Very important question. Many people ask me this question. When I finished my MD, MRCP in UK, I was working in the Department of Rheumatology in United Kingdom. That was in early 70s. Then itself, medical science had known that rheumatoid arthritis is a psychosomatic disease. Of course, those days we used to call it a psychosomatic. Later it became mind-body medicine. Now we call it lifestyle disease. But only names have changed. What do we mean by psychosomatic? We knew that whatever fighting is going on in the joints, which is autoimmunity, is all because of the overstrained nervous system, overthinking, etc. Therefore, they call it as psychosomatic. For 40 years, enormous amount of research has gone on to understand how mind gets connected to this inflammation or fighting that is going on in the joints. But knowing this, we have progressed a long way in controlling this inflammation, stopping this inflammation, so that people can live a long life. But we already knew that mind is the root cause. What are we doing with the mind? So as early as 1970s, when I was working in rheumatoid disease, I used to go to the ward filled with large number of patients in a dormitory-like setup, and I had to go and tell them, look, mind is the cause, you have to relax, and I will teach you how to sleep without getting stressed out. And I would give instructions to the entire ward and they would get good sleep. So mind management is so very important. And by that time already I was trained in yoga.
Right.
I was doing my own yoga. So we decided that we should introduce these concepts as an adjunct
Correct.
to whatever is happening in medical science today.
Absolutely.
That's how I got interested in this. And I came back to India. I straight went to Kanyakumari, sat with my brother Dr. Nagendra, and started thinking about how to incorporate this.
Right. Absolutely. So very wonderful. So, ma'am, what are the key practices of yoga therapy that you implement in Arogyadhama for the participants?
As you rightly said, at present we have a health home, Arogyadhama, in our campus in Prashanti Kutiram in the south of Bangalore, about 35 kilometers, totally away from the hustle bustle of a city.
Right.
We have a 400-bed facility where patients with various lifestyle diseases come and get admitted, and we have to select separate set of practices depending on the disease. Just like a single medicine cannot be given for all diseases.
Absolutely.
We cannot have same yoga for everybody.
Correct.
And yoga is not just physical postures. Yoga has to include the basic concepts from traditional text, which says yoga basically by definition has not said asana is yoga.
Correct.
Physical posture is yoga. Yoga they have defined as mastery over the modifications of the mind, which we call as MMM. To make it easy, we say mastery over the monkeying of the mind.
Correct.
So this is the definition of yoga. So for that, sages have given us large number of techniques at the physical level, breathing level, mind level, emotions level, intellectual level, and using all these as an integration, we select our specific practices which will be suitable for the individual and give them the least training in that.
Right. So there are individual yoga modules for most of the diseases that we see these
it has
days.
To be a,
Correct.
It has to be a specific module.
Correct.
We call it as special techniques.
Right.
But we have to incorporate all the concepts of Ashtanga Yoga.
Correct.
Yama, Niyama, Asana, Pranayama, meditation, and not only the Ashtanga Yoga, we incorporate the major 4 streams,
Right.
which we call as
Right.
Raja Yoga, Karma Yoga, Bhakti Yoga, Jnana Yoga, as portrayed by Swami Vivekananda.
So ma'am, in your experience, out of all the diseases that we see in this era, which are the most common diseases that get really good response with yoga therapy?
All those diseases which have got mind as the root cause is the major thing. So we call it as stress-induced diseases or Adhija Vyadhi in Sanskrit, which are today called as non-communicable diseases.
Right.
We divide all diseases into communicable, non-communicable. We have all experienced the danger of COVID, the communicable disease. There also yoga has an important role. We had prepared modules for helping people with COVID because they were all highly stressed. So basically, we have to change the lifestyle of the person.
Right.
Lifestyle means healthy diet, simple, wholesome, vegetarian, regular, homemade, freshly cooked, timely food taken in with pleasant mood and not by seeing a fighting movie or something like that.
Right.
And physical activity.
Correct.
And regular habits. What has happened in today's lifestyle? Habits have totally changed, particularly youngsters are sleeping at 2 a.m., waking up at 9 a.m.,
Right.
brush their teeth and rush for work.
Correct.
This biorhythm is very, very important. And last but not the least is the stress management. Now today we are all stressed for whatever reason, which may be different for different people.
Correct.
But stress is a thing which has to be handled by working on the mind. Therefore, it's very important to help them with lifestyle change and incorporate specific diet, specific physical activity, specific habits of eating, sleeping, particularly sleep habits, very, very important, and stress management. So we incorporate all these and we are getting very good results. You ask me which is the easiest disease to treat.
Yeah.
So if I take 100 diseases which we handle here,
Correct.
I tell you nasal allergy is the easiest.
Easiest. Oh, okay. So there are so many people who suffer from not just nasal allergies, but so many other allergies,
Yeah,
food
yeah.
allergens and other these days, really. So this is quite interesting when you said that stress is so very common. But what I understand, ma'am, with what you said just now, that though it is common, it need not be natural, it need not be normal. So something that is common, we did not normalize it. We will have to learn a pattern, we will have to change from within to how to respond to the stress. Definitely.
Exactly.
So Didi, when we understand lifestyle is so very important, how do you think that people have accepted yoga therapy in the mainstream conventional medicine?
Yeah, mainstream conventional medicine wants evidence.
Right.
For anything that you do, if you want to incorporate something, a new drug comes, for example.
Correct.
How will they incorporate that? Because they have research evidence.
Right.
Research evidence has gone through for probably 5 years of research, phase 1, 2, 3, 4 trials, and then it comes to the market. So similarly, if I have to change the diet of a person or incorporate some physical activity yogically, for example, for last 20, 30 years, we know that how important diet is, how important physical activity is. So what they did, they published papers, made it popular on the media, and people started saying that physical activity is important. And today we know every watch gives you how much
Exactly.
physical activity you
Yes.
have done.
Right.
Parks and gyms, aerobic exercises, all these were opened up. So people were given the awareness through media
Correct.
based on the research
Based on
that was
research.
going on. So similarly, for yoga also, we have produced large amount of research evidence.
Right.
Once the research evidence comes by publications in indexed, peer-reviewed journals, which give the stamp, okay, this
Correct.
is acceptable by the medical profession.
Right.
For example, we published our first paper in a British Medical Journal on bronchial asthma on 650 people and 52 people, one group yoga, one group non-yoga. And this became published in the British Medical Journal.
Right.
After we were seeing that, immediately after that, there were large number of inquiries
Correct.
that were coming from general population, of course, and by the medical professionals also.
Correct.
And then it entered into teaching books. Any medical textbook you see on asthma will incorporate that. Integrated yoga is very useful for asthma. So that's how it gets accepted. So based on that, we have now published more than 800 papers
Correct.
on various diseases to create evidence that is only from our institution. But round the globe, there are more than 5,000 research papers published on the physiological effects, how pathology gets corrected, how it will help them clinically.
Right.
All these evidence,
Evidence.
research evidence. This is what we mean by best of the West and best of the East. We pick up the best of the East from the traditional texts
Correct.
and experiences of great masters,
Right.
contemporary yoga masters. In fact, I should share this with you.
Yes.
When I came back and started thinking that we should do something more seriously and involve myself fully into yoga therapy, I also did not know what asana or what pranayama, what meditation I should teach to a person who would come with a hypertension or back pain or acidity or asthma. So I went around the entire country where there were great ashrams, great masters who were doing therapy work. Not all yoga centers would do therapy work. So we picked up, started from the east, Hyderabad, then from the far east, from Kolkata, Guwahati, West Rajasthan, down to Maharashtra, where they were actually treating patients. Sat there with my yoga therapist and we observed patients. We started seeing patients who come there. I remember one lady I saw in Guwahati. That lady was there with heavy menorrhagia, perimenopausal.
Okay.
And perimenopausal menorrhagia is very common. And they were proposing her for hysterectomy. And because she was so anemic, the doctors had said, we have to improve your anemia. We'll give you 1 month's time. Then we will remove the uterus. This lady, apart from taking the AN tablets, she came to the nearby ashram. When Swamiji was there uphill in Guwahati. And that Swamiji taught her some practices and she wanted to practice it. And very next menstrual cycle had become totally normal. The menorrhagia which was going on for months.
Oh, I see.
And I interviewed her. I asked her what you learned, how you learned, how much you are practicing, documented, and sat with the Swamiji and asked him what you taught her, why you taught her, how it would work on her, whatever he could make us understand. I documented it. So like this went on interviewing large number of patients. Almost 3 to 4 months we went around the whole country and saw the one-to-one evidence because those days there were no published research medical journal related evidence. So based on that, we started thinking. And very interestingly, I should share this with you. When we came back and sat in Kanyakumari, myself, Guruji and our yoga therapist, we started comparing. Okay, this Swami says you should do more meditation. That Swami says you should do more asana. Some Swami says this asana is very bad for headache. That Swami says this is very good for epilepsy. We were totally confused for a while. अरे ये data पकड़ के क्या करना है? What are we going to do with this data?
Correct.
We could have easily discarded it. But we thought, no, I have seen the participant,
Right.
I have seen the results. Then how is it helping? Why there is so much diversity? Then Dr. Nagendra, one day in his meditation, he came out of meditation and said, now we got the answer. They are all doing yoga.
Correct.
It may be this asana, that pranayama, that meditation, this one. But they all have taught them how to handle their mind. Yoga is mind management. Mastery over the modification of the mind. So, through this asana, this pranayama, that pranayama is less important. What is it that we have to do is to help them to concentrate and deconcentrate and help them to silence the mind, give deep rest to the nervous system. And this is what is yoga. And we started working. With our knowledge of the disease process, we could add on a little more modern medical knowledge, the pathology knowledge. As to if somebody puts on a headstand, what would happen to a person with hypertension? It would be dangerous, so I avoid that. If somebody has got diabetes, he can't be just doing simple breathing because he has to need some more exercise.
Correct.
So we added extra Surya Namaskar. Like this, using the concepts from the tradition, concepts from our medical knowledge, we were able to design modules and put it into practice, apply it to groups of people, pilot studies in 5 or 10, make necessary changes, and then do randomized control trials, one group with yoga, one group without yoga, add on. Everything is to be add on.
Correct.
That is how we were able to publish in British Medical Journal, where for the first time we were able to show how much medication reduction happened.
Nice.
So this is how we have to build up, how to make yoga therapy as an add-on.
Correct.
Selecting the practices called specific practices for the disease and help people to recover from their medication requirement.
Absolutely.
Majority of people, what we find is, my job is only to help them to reduce their medication rather than add on. Of course,
Correct.
occasionally I may have to add on some medication. So
Correct.
what we say is, it is like mind is the root, disease is at the branch.
Correct.
And allopathy, discovering what exactly is happening at the cellular level, at the chemical level, we discover drugs which will help them to counter that
Correct.
chemical which is excessive or add on that chemical which is missing. This is like cutting the branches of a tree. But the medical science has said that the root is the mind. So we work with yoga at the mind level, stem level, detoxification through natural methods, healthy diet, etc. And allopathy medication automatically starts coming down. This is how we have to work on the removing the root cause of the disease and help them to come out of the disease and have a very good quality of life. It is fascinating to see how patients with severe problems conglomerate all these and come out of the problems.
Right.
Every day there is a miracle in our campus.
So nice. So we usually just look at the outside symptoms. We forget the root. That is so very important.
Exactly.
So if we are not taking care of
And
the root.
medical science has proven that.
Exactly. Yes. So true. So true. So ma'am, you have authored so many books on different ailments. Can you give some insight or some one principle for our readers? about the publications that you have done so far? Some insight on it.
See, what we started doing was these research publications where we have research evidence which goes through, they submit it to a very good journal, there will be a review committee, they will ask you 100 questions, you have a lot of rebuttal and go through this and gets published in a, this is the most important, that to randomized control studies are the best evidence that is possible. So we did that, and based on that we started writing these books. So we have written, we have in our Arogyadhama 8 to 10 departments, separate department for endocrinology, where we admit patients with diabetes or other endocrinal problems. Back pain department is totally different. Hypertension department is totally different. Respiratory department, rheumatology department, because what a diabetes patient who is young and energetic can do cannot be given to hypertension patients. So we have separate set of pranayama, separate set of asana, separate set of meditation for all of them, and separate set of understanding. What is very important for the present generation is when we see a participant, we make them understand how mind is related to that particular disease, how hypertension is a mind-body disease. These patients do not know. Correct. So what we make them understand is how mind becomes excited, stimulated, stressed up, responding at a very heightened level of speed, which persists and creates a lot of stress on the overwork on the nervous system, which releases wrong chemicals, which works on the sympathetic nervous system, which activates the peripheral arteries, tightens up the artery and creates hypertension. This understanding of how stress works on the body, if they understand, then we bring them to the awareness that they should be able to work on the mind. Mind calming down, slowing down, switching off the mind is very, very important for that this practice. So once they understand with deep awareness, they will be able to relax, rest to the organ by doing an asana or pranayama and meditation and intellectual yoga and devotional yoga. So this way we go on designing techniques in 10 different departments, and based on that evidence we write up these books. When we write a book on arthritis, we make them understand what present-day medical science wants to understand about role of stress in that particular disease, what exactly happens in the body, what are the chemical changes that happen, how it settles down in the disease, and correspondingly we talk about the knowledge from the traditional books. So there will be a section on the disease as understood by Western medicine, a section as understood by our Yoga Vasishta and other yogic texts, and how we are going to incorporate this, which practice should not be done, which practice should be done with greater emphasis, and give them the module. So the book will give 2 or 3 list of practices. One list of practice for a person who has got very mild arthritis, a person who has got rheumatoid arthritis, a knee pain special technique hoga, or arthritis special technique hoga. So 2 or 3 lists will be prepared and presented with explanation of the way to do it. So every book has got the Western concept, Eastern concept, the basis of healing through yoga, and the practice list, explanation of the practice. So this way we have got several books for different diseases. We could do more, many more diseases, books can be brought out. Our emphasis is basically to create scientific evidence.
Correct, absolutely. Nowadays yoga is becoming so very popular, and every single person out there has got few practices to instruct each and everyone coming out. But I think what I understand from your talk today is that it's very important to understand what we are not supposed to do.
Yeah.
Contraindications are equally important.
Very, very
so we know there are 10 practices, but out of those 10, there may be some we are not supposed to do.
Exactly.
Yeah. So contraindicate and customizing it as per the necessity, because people come with associated comorbidities also.
Exactly.
Diabetes with obesity, diabetes
Very
with
common.
hypertension. So here someone wants to lose weight, at the other side the blood pressure is so very high, so cannot do dynamic practices. So very, very important that we bring research into play. Coming to yoga therapy education and research, SVYASA Yoga University is the worldwide yoga university where so many students get educated in the field of yoga therapy. So not only Arogyadhama, these students, cut.
Continue.
Okay. So how would you want the students, or what are the key points that you would want students to know when they pursue yoga therapy as education?
Yeah, it's very interesting, Dr. Nivedita. When we decided in early 2004, even before that, when we started our work in 1970s itself, we started incorporating it in education also. People started asking, we started with yoga instructors course, yoga therapy instructor, YTIC we used to call it as yoga therapy instructor course, diploma in yoga therapy, and then when we became an university, we were able to call it as BSc in yoga, MSc in yoga, PhD in yoga. In fact, even before BSc, MSc came, which is permissible only when we became a university in 2004, we already had PhDs, which was being given by Rajiv Gandhi University because we had MOUs with them.
Okay.
People started asking, what is there to do? 3 years of study in yoga, BSc in yoga, what are you going to teach? What is there to study in MSc yoga and PhD yoga? This is something very funny, very strange. But from our point of view, there is more literature in yoga to study than even in Western medicine. Western medicine is only focused to understanding the body physiology, anatomy, physiology, pathology, and go deeper into surgical procedures, etc. But here is a vast knowledge of yoga. If you really go into the literature, Vedic literature, it starts. So we incorporate knowledge from the traditional, starting from Vedas, Upanishads, Bhagavad Gita, Yoga Vasishta, Patanjali Yoga Sutra, Narada Bhakti Sutra, etc. and make it relevant to therapy, make it relevant to prevent diseases, treat diseases, rehabilitation in diseases, and take them to higher levels of human evolution. Yoga is a science. We say that if there is a normal, healthy person where everything is functional normally, he has a big scope to move towards a better human being, superhuman being, divine human being, where he will get into greater and greater heights of mastery over himself. And a person who is down this health zone where they become sick also can be taken from sick zone to normal zone to superhuman zone to divine stage. So this is where we have enormous fund of knowledge. We incorporate in very simplified way, very relevant way, starting with what we call as Panchakosha Viveka. The biggest and the most fundamental knowledge base is to make our students understand how our system is functioning and what is our body. Who am I?
Right.
Who am I? This question is never asked in medical science. And we take in medical science that it is all this physical body, and it was in 16th century, people said, we have understood everything about the body. It is working like a mega clock, which you can repair if there is something wrong.
Correct.
We don't need all this spirituality, all this understanding about mind. So whenever we wanted to talk about mind, we used to call it as placebo. Placebo control trials, where if a person uses his mind to correct himself, it is discarded as no research evidence. But mind is the most important. So for this we start with a Panchakosha concept, or the 5 aspects of our personality. Physical body, which is only the anatomy, which is nothing but what we can see in the dead body also.
Correct.
And how is dead body becoming a functional body, which is the prana. What is prana? A lot of knowledge about that. And if a person is unconscious, alive with coma, is still alive but is not in a human personality as a total. So what is that extra thing? Sages called it as Manomaya Kosha, which receives information, perception, analysis, and response in the form of emotions or intellectual response. And behind that, we all have 2 minds. One mind, which is our monkey mind, which receives response. If somebody hurts me, we immediately get reactive. I get hurt, I may shout at him. This is animal way of living. This is the lower mind. Then we have the inner mind, which is the Vijnanamaya Kosha. It says, hey, please stop. You are not going to shout, you are not going to scream. Hold it, you have to change your response, because he is your boss who is hurting you. You will lose your job if you shout at him. Who is that inner eye who tells you the answer? It is called Vijnanamaya Kosha,
Correct.
which is the right knowledge. And behind that, we all want to be happy human beings. What is that happy state? What is the most common happiest state, which is common to all human beings? Sleep.
Sleep.
What are you in sleep? You are very happy. Why? Your mind is switched off, and that state where you are in deep silence, without any activity of the mind, no awareness of the breathing, no awareness of body.
Correct.
You are totally in that blissful state. They called it as Anandamaya Kosha. Not that I am saying that everybody should be put to sleep, but sleep is one of my aspects. Rest is the healer. So if somebody is sick, we give them Nidra, Yoga Nidra. Sleep without awareness, but conscious switching off of the mind is the healer within. So we make them understand all this as a full topic. So this becomes a 2 years, 3 years topic to go into deeper and deeper and deeper understanding of Panchakosha Viveka, happiness analysis, how to convert all our work into work without getting worked up, Karma Yoga, and how to use our loving nature, which is our most favorite and most wanted human requirement, how to use that emotional management, and all these we introduce in a very simple term in the first year. Then they go into deeper text and go into most deeper text and do some research also on that and start working on that. So this is how the Eastern knowledge is taken. Then coming to Western knowledge, of course, all the medical science knowledge, which is made to be understood by the lay people. They go through anatomy, physiology, pathology, psychology, and probably dynamics of the whole physiological changes, etc., and how to connect this, how to connect mind to the body, what modern science has understood about HPA axis,
Right.
hypothalamus pituitary axis, how mind works on the limbic cortex, hypothalamus, all these, we make it in a very understandable language.
Correct.
And help them. So there is enormous literature which can be taken up to even PhD level. So we develop these syllabi, coordinate with other institutions. And what is most important is we impress upon our students that they should experience what they are talking about. It's not enough if you just become a teacher. What you experience only you can communicate to others. For example, if you have to be a primary school teacher, you should have your master's degree, you should have your B.Ed degree. If you want to be a teacher for master degree students, you should be a PhD. Like this, in yoga also, you have to be a PhD student, PhD owner with internal experience of what this internal science is all about. This is totally an internal science. I do go close my eyes. In fact, saying this, I am reminded who said, I am doing yoga 3 hours a day, but my knee pain is not gone, my acidity is not gone, my diabetes is not gone. He was overweight also. I asked him, 3 hours? Yoga? How come you have not been able to heal your diabetes? Then slowly his wife said, Sir, ma'am, he does it yoga by looking at the TV. टीवी में पॉलिटिक्स चलता रहता है, देखते रहते हैं, प्राणायाम करते रहते हैं, आसन करते रहते हैं. So definitely our students are made to experience that.
Correct.
They have to close their eyes, turn inwards and recognize, and our students achieve this so nicely. In fact, we conduct competitions also. Who can sit in an asana without getting distracted, with a comfortable sthira sukham asanam for 20 minutes, 30 minutes. This becomes a competition also. So this way we train them to experience. So practical is more important, and also they work with our patients to teach them also. So our BSc, MSc students, having stayed in this Gurukula system of education, where emphasis is given to 50 to 60% on practice, sadhana, lifestyle, healthy diet, simple, wholesome, vegetarian, and regular asanas and advanced asanas if they are young people, meditation, relaxation, practical theory. So we have developed this syllabi, which is now acceptable around the globe, because we made this so much acceptable that many universities in India and abroad are following these syllabi of our degree courses and our PhD modules.
Right. So what I now understand is yoga therapy is so much in alignment with what WHO has already told. Health to be the complete state of physical, mental and social well-being, and not just merely the absence of disease or infirmity.
Yeah.
I think, yes ma'am. So could you...
See, what you said it right. Although we said it is physical, mental, social, spiritual health that we have to achieve for humanity at large, what are we doing in medical science? Does any doctor who comes out with a super specialization does know anything about spiritual health? Does he know anything about mental health? If you are a very good doctor and very sincere doctor also, a big brain surgeon for example, you go to a brain surgeon and ask him, I want to achieve World Health Organization definition, please teach me about spiritual health. If you are a good doctor, you will say, yes, my dear friend, I don't know about spirituality, but I have a guru whom I respect, genuine guru. I'll send you to him, he will guide you on spirituality. So this incorporating this knowledge, the Vedas, Upanishads, Indian knowledge, which has nothing to do with any religion or caste or creed, is to be incorporated scientifically with evidence. And once this gets incorporated, then we can work on the holistic approach of handling all these NCDs, non-communicable diseases. And it is a fascinating experience over 30 years to see how we are evolving. And our yoga therapists who are not doctors, they do a wonderful job by helping our participants to understand this concept of deep internal conscious rest to the sick organ by doing all these techniques, and it's very fascinating to see our students when they go out of our university are accepted all over the world, because it is not a particular religious practice, it is totally scientific.
Correct. So, ma'am, in the field of practice that you had from so many years, what is the most common misconception that the people have about yoga?
This is the misconception that I told you, that yoga is something to do with Hindu religion, and therefore Hindu practices cannot be done by a Muslim or a Christian or Jainism, Sikhism. These are all come out of Hindu techniques, so they don't rebel. But totally non-Hindu religions, particularly Muslims. So they start with, no, we come to learn yoga because you have got research evidence, but I don't want to do this Om meditation. I don't want to sing this mantra. Mantra is in Sanskrit, but what we selected was totally universal.
Correct.
For example, when we sing Sarve Bhavantu Sukhina, let everyone be free, we make them understand and tell them, you're only wishing that everyone be happy, healthy and free from diseases. There is no particular word God there, so you can also sing. And if they are so reluctant, we even give them translated version of that.
Correct.
Asatoma Satgamaya, oh, the divine energy, lead me from darkness to light, lead me from death to immortality. If you don't want to chant it in Sanskrit, chant it in English, no problem. So these misconceptions are going now. People have accepted yoga universally, and very interestingly, it's good that you asked, people in Turkey adopted it so deeply. It's a Muslim country,
Correct.
but they have adopted yoga intensely. China, a communistic country, there are universities which are in collaboration with us to teach yoga. So we make it not as a religion but spirituality. Spirituality and religion are totally different.
I think we all need to understand the two difference between what is religion and what is spirituality, and that's where people get confused.
Exactly.
Right. So, ma'am, where do you see the future of yoga therapy now?
I strongly feel that yoga should become number one and medicine become secondary in therapy, because we are talking about prevention of diseases by lifestyle change. We have medical science over 50 years of research. What have we reached? We have come to the stage where we talk that they are all lifestyle diseases. They are all non-communicable diseases. There's a lot of role in, even in infections. I'll tell you this important thing. In COVID, what happened? There was a big onslaught by the very dangerous virus and body was collapsing.
Correct.
Then even the medical professionals who had nothing to do with yoga started realizing that it was the body's intense stress that was releasing wrong chemicals which was killing the people. It was not the virus that was killing the people. It was the stress and stress-related hyperimmune reaction which was attacking our own immune system, hyperactivated, overactivated, started attacking one's kidneys, started attacking all the organs and the heart in particular, and people were collapsing. This is when even in a pandemic or a external infection, which we call as Anadija there also stress has an important role. But in these non-communicable diseases, though it is totally mind, so mind management is very important. And in the future, I visualize that probably in your generation, from next 30, 40 years to come, it will all be yoga, primary prevention, and everybody will accept a sattvic diet, sattvic exercises. And when I said sattvic exercises, I am reminded there are people who do what we call as high intensity exercise, HIIT, which has also created a lot of problem. So it's not only exercise of a very high intensity for a normal human being that is important, but it has to be exercise with lot of relaxation. Exercise followed by rest. So it is the balancing of the entire mind-body complex by deep relaxation, which Vasishtha calls as Manah Prashamana Upayaha. Mind slowing down trick is yoga. Giving deep rest to each and every cell in the body in a very highly balanced way is what is going to be the primary thing. So if there is a hospital, anybody who comes to the outpatient with a disease will first see the yoga person.
Correct.
Then he will get to the lifestyle person. Then he will see the expert. By that time, it's happening already. In the West, say the anxiety neurosis has become so very prevalent. The psychiatric appointment you may get after 3 months,
Correct.
4 months. Person is suffering. So what they have recognized is, during this waiting period, they all should do what they called as Jacksonian relaxation. Somebody by Jackson picked up this deep relaxation technique or Shavasana that we do in Indian yoga. They call it as Jacksonian relaxation. It's purely Shavasana. And so they should go through this Jacksonian relaxation, and by the time they reach the doctor, they are already better. So it's already happening. So this is the future. By producing more evidence in these areas with the right type of training, right type of research evidence, this should be the primary thing. Prevention is better than cure can be really, really achieved, not just as a slogan, but as a methodology which can be implemented for the entire humanity. There is no choice than doing this, because drug world is becoming very, very dangerous.
Correct. Ma'am, could you please tell us the different career options that are there in the field of yoga therapy? Scope for the students.
Yeah, I'll tell you an example. There was a family, his father was working with us, and these were twin boys.
Okay.
Both of them went into engineering. Both of them, because those days, about 20 years back, engineering students had very good scope, although today all engineers, only 15% get occupations, appointments. They are all changing this one. But those days they were both they are both engineers. They were looking for very high paid jobs, and the elder, one of the twins joined a software company, and he was earning quite well. The other twin, because of his connection with us in the university, because his father was working with us, he spent 2 more years after his graduation to do our master's degree.
Okay.
And it was very interesting to see that after his MSc in yoga with background of BE, Bachelor of Engineering, he was earning more than his brother. So people have realized this is one part of it. Add-on yoga is not only for the health of the professionals, but it has now become a profession by itself. About 30 years back, we used to say yoga is for free sadhana. It is going to help you for spiritual growth. It is only to be taught freely. But now it has become an industry. It has become a big profession. And what is happening is many people who are professionals, once they just start learning yoga for their own health, for their own growth, for their own stress management particularly, because life has become so fast, all professionals, corporates, CEOs, they are going through a lot of stress. What they are finding is, up to the age of 35, maximum 40, they are already exhausted. They have got a lot of stress problems, and they are now giving up this highly paid highly progressive, highly rewarding jobs and shifting out to yoga therapy, and they are able to sustain their financial requirements also by switching off from their IT to IT,
Right.
information technology jobs to yoga therapy jobs, which is both rewarding for them and for continuing their family, for their offsprings, and also for the society at large. We can see the joy in them, no stress-free life that is going on. It's a very progressive, infantile specialization which will be taken up, and people will be rewarded both by their own personal gain and personal gain and a social gain.
Very nice, ma'am. So, ma'am, what is your message for the youths today?
Message for the youth is that if you are a yoga professional, yoga therapist, yoga teacher, I have one direct request, one important request. Don't overcrowd yourself with your yoga classes. Anything more than 4-hour classes per day is going to be harmful for your own health, because when you are teaching yoga, you tend to think, okay, I'm teaching, I'm doing my asana along with them, so I need not spend my own time. Sorry, that is not acceptable, because when you are teaching, your mind is going out. Yoga is to turn inside. So please keep 1 to 2 hours of sadhana yourself, working at the body, breathing, mind, and most important, going to the fundamental knowledge base of Upanishads, etc., should be your part of your daily routine, because this is a science which is an experiential science which you are going to share with your clients. This is the first message. And message for the non-yoga exposed youth is to see that you come out of their rush and speed and fastness. I know of many of my yoga oriented youngsters who are designing mobile based games. Today mobile games has become a big addiction for youngsters.
Right.
What happens in all these games? Faster you are going to win. So our yoga based youngsters in the country, both in India and abroad, what they are designing is, if you think slowly, you will win the game. So this is the concept of Manaprashamana. They are able to attract youngsters through, and the whole message is have some time for introspection. Turn your mind inwards, look at yourself, and see how you can give deep rest to the mind-body complex. Switch off the extreme rush and speed for achieving. Yes, as an youngster you have to achieve. Achievement will become much better if you know how to switch off the mind. It's something like your mind is like this. You are doing, you get exhausted. What yoga tells us is, you rest. You go to that silent state of mind. Then your range of performance, range of creativity, range of intellectual capacity, range of analytical capacity, range of memory, range of your physical health has a wider scope to achieve. So please give time for yourself, at least if you are a very professionally oriented course student, give at least 2 hours during the weekends to do your asana pranayama, because you are going to be too busy over the weekdays. And once you understand these concepts, you should be able to get that joy inside without having to rush for achievement outside and get into stress.
Right. So beautifully put, ma'am. So it is moving from alertness to awareness and reaction to response. So nice. So what we understand is yoga is a journey of the self, through the self, for the self. Thank you so much, ma'am, for the session and answering the questions for today. Namaste.
Namaste.